I'm gonna go on a rant here again. Bear with me. Why do people panic when faced with the normal anion gap metabolic acidosis? In this small rant, I'm going to debunk the normal anion gap once and for all. In the grand scheme of kidney problems, the normal anion gap is one of the easiest things to figure out. There are only three main causes of the normal anion gap. Firstly, is that you've given too much sodium chloride. Secondly, is that you've lost too much base from your gut. For example, if you've been having diarrhea. Thirdly, is if your kidneys have lost the ability to prevent the blood from becoming acidic. And there's a fancy name for it called renal tubular acidosis. So to recap, there's only three main causes: too much sodium chloride, gut loss, and renal tubular acidosis. Now, how do you diagnose and how do you treat? Firstly, if it's too much sodium chloride, stop the sodium chloride. Replace the fluid with something else, like Hartmann's, for example, and watch the bicarbonate rise. And now, how do you differentiate bicarbonate loss from the gut, as well as renal tubular acidosis? And this is where your urine anion gap comes in. So you calculate your urine anion gap, you can look it up. If it's negative, then you know that the cause for the metabolic acidosis is from the gut. So you're losing base from the gut. If your urine anion gap is positive, then it's pointing towards renal tubular acidosis. That's it. An easy way to remember this is if your urine anion gap is negative or negative, then you're losing base from the gut. And how do you manage? If it's gut loss, stop the gut loss by either resolving the diarrhea or resolving the high stomal output, for example. If it's renal tubular acidosis, phone your friendly renal physician. So next time you have a normal anion gap metabolic acidosis, you know what to do.